Okay, so we're going to talk about the immune system next. The newborn immune system doesn't actually function extremely well at the beginning, and so maternal antibodies are passed through the placenta, and they last about 3 months. If a baby is breastfed, then they continue getting maternal antibodies as long as they're being breastfed. A newborn can produce a response to a vaccine within the first few hours, but they don't really effectively fight infection. So white blood cell count tends to rise slowly in the presence of an infection. The risk for infection is higher in the first several months of life, and infections spread rapidly. Also, remember that a lot of the symptoms of infection are actually symptoms of our body fighting the infection. They're symptoms of that inflammatory process, redness and swelling and fever and pain and all those things. Those things are mostly symptoms of our bodies trying to fight the infection. So a newborn is not going to have really, really overt symptoms most of the time. Their symptoms can be very vague. They're not likely to have fever due to an infection. They're much more likely to have hypothermia. In fact, commonly, one of the only signs is a newborn who should be able to maintain their temperature isn't. They just keep dropping for some reason. The newborn with an infection may be lethargic, may be irritable and fussy, may feed poorly, may have vomiting and diarrhea. They may have decreased reflexes. They may have a pale or mottled skin color. They may have apneic episodes or tachypnea or signs of respiratory distress. And that's even if the infection is not in the lungs. We're going to talk about neonatal sepsis in the complications lecture, but early sepsis is usually contracted in utero. This is one of the reasons that we give antibiotics for patients who are group B strep positive, because that was a common cause of early neonatal sepsis. Late neonatal sepsis is usually contracted after birth. Okay, so the next section is going to be about newborn skin, integumentary system.